Welcome to Chapter 11, the Muscular System. This is where we go over all of the different muscles and how they're named, where they're located, all of that information that's pretty similar to what we're learning in the practical. So luckily, these help each other during both the lecture and the practical. We're going to go over the ones that show up on the lecture exam. To review, there are three muscle types: skeletal, cardiac, and smooth. Skeletal muscles are the ones we're going to be going over, and they attach to the skeleton itself. Here are some large muscle fiber cells. They run from left to right in a horizontal line. That is one muscle fiber cell. And all of those small striations that are visible are the different bands of the thick and thin filament. Here's a cross section of that same muscle. You're able to see all of the nuclei pushed to the side, and all of those myofibril rods are coming towards you, so you're not seeing the striations in this view. You can see how they're bundled together with the epimysium, the perimysium, all of that connective tissue surrounding them. Cardiac muscle is different. It doesn't have those straight parallel lines. Instead, it has branching cells with intercalated discs. You see, with the heart, there's no skeleton for it to attach to. Instead, it just weaves around the organ. Here's a slide of cardiac muscle tissue. The biggest difference between the skeletal and the cardiac is going to be that unlike the skeletal, where every muscle fiber cell just runs in one straight line, cardiac has branching. It also has the connections called intercalated discs. This is a smooth muscle cell. Smooth muscle cells are the ones that we found in the walls of our internal organs, our blood vessels, and our eyes, and their function depends on where they're located, but these guys are involuntary and they lack striations. This picture that shows the narrowed ends in the big middle, that's an example of a relaxed smooth muscle fiber. When it contracts, it just gets smaller. This allows us to constrict a tube perfectly when it comes to the tube in our digestive tract or in our airways. And when it constricts, all of those individual little smooth muscle fiber cells contract, and that causes the entire structure to shrink and give us a smaller diameter, maybe pushing something through if it was food. Looking at smooth muscle under a microscope, it's very hard to even make out the connective tissue. You just see pretty much that pink muscle fiber with a few nucleus squeezed in there. Here is an electron microscope view showing a relaxed muscle on the left and a contracted muscle on the right. Here is skeletal muscle on top, cardiac muscle in the middle, and smooth muscle on the bottom. This is what we would see on the slides in lab. Skeletal muscle on the left, smooth muscle in the middle, and cardiac muscle on the right. Skeletal muscle, you see, has those straight lines of its muscle fiber cells, whereas the cardiac is branching and has a lot more nuclei throughout it. All right, now that we've gone and looked at the histology, let's go to the skeletal muscles themselves. There are 5 golden rules of skeletal muscle activity. Number 1, all muscles cross at least one joint, with a couple exceptions, but they're the anomalies. 2, the bulk of muscles lie proximal to the joint crossed. 3, all muscles have at least 2 attachments, an origin and an insertion. 4, muscles can only pull, they never push. 5, during contraction, the muscle insertion moves towards the origin. What is a muscle's origin and insertion? Every skeletal muscle is attached to bone or connective tissue at 2+ points. The origin is the point that is attached to the immovable or the less movable bone. The insertion is where it is attached to the movable bone. In this example, the pelvis is much more stable and unmovable than your knee is. So the attachment to the pelvis is the origin, and the attachment to your knee is the insertion. Here's another example. This muscle is in your upper arm, and it connects at your shoulder and down at your forearm. The less movable connection is going to be at the shoulder, so that is the origin. The movable one is your forearm, so that is the insertion. There are a couple of different muscle fiber organizations that we see in the body. We learned that muscles are composed of fascicles, but how those fascicles are arranged is very important. They could have a circular arrangement. Circular fascicles surround your lips, and they also surround your eyes. Whenever they contract, they allow you to purse your lips or squint your eyes. And they're also used in the body as sphincters. Parallel arrangement is when all those fascicles are running parallel to their long axis. Your six-pack is an example of this. Convergent is where there is a large origin and a small insertion. A few others are the pinnates. This is when the fascicles have oblique angles to the tendons that attach them. They could be uni, bi, or multi, depending on how many of them are formed. What are the actions of skeletal muscles? We know that muscles work together to produce movement, but there's a couple of different names for our muscles during each movement. They are grouped by their primary actions. First, there is the agonist. This is the primary mover. Its contraction produces the movement. The antagonist opposes the action of the agonist, relaxing when the agonist contracts. The synergist will assist the agonist in its action and help stabilize the joint. Let's put that into practice. If you were watching some old school Batman, Batman is the agonist. He is the primary mover, the superhero. His synergist is Robin. He assists the agonist. The antagonist is going to be all of these guys. Joker, Riddler, the Penguin, Catwoman. They are all the antagonists that are opposed to the agonist. Your biceps is the agonist in this picture. When your bicep contracts, it pulls the hand up like you were doing dumbbell curls. The antagonist is the triceps. When the bicep contracts and pulls the arm up in that flex, your tricep is on the opposite side relaxing. Whenever you want to put your arm back down, the triceps will then contract, becoming the agonist, and pulling the arm down while the biceps relax. So they take turns. Nobody pushes to move your arm up or down. It's only the pulling of the muscle on the opposite side of the arm that when it pulls, it reverses the motion of the first muscle. When it comes to naming the skeletal muscles, there's a couple of different things that are used. First, we use the location of the muscle. Normally, they're associated with a bone, like the temporalis muscle connects to your temporal bone. But other times, multiple muscles attach to the same bone. So we can also use the shape of the muscle. We can call it deltoid if it's a triangle shape, trapezius if it's a trapezoid shape. Say there are 3 similar shaped muscles all attached to the same bone, but they're different sizes. Then we can use words like maximus or minimus to kind of denote which one's the bigger and the smaller one. Longus might be the longer one, maybe there's a shorter one. We can also use the direction of the muscle fibers. Rectus means straight, whereas we also see transverse or oblique muscles. The number of origins for a muscle can be used as well. The biceps has 2 origins. The triceps has 3, Quadriceps has 4. So whenever you see the bi or tri or quad names, typically that's what it's referring to. The location of the attachments can be used as well. There's a muscle called the sternocleidomastoid. That is a mouthful. But if you start breaking down the words, you can actually kind of make out where it comes from. It's a muscle that attaches to the sternum and the clavicle and inserts onto the mastoid. So they just took those 3 names and just mashed them together. Lastly, the action of the muscle can be used to name it. If a muscle flexes, we might call it the flexor. If it extends, we might call it the extensor. The adductor versus the abductor. So those are all useful as well. These charts give us examples of a lot of these muscle names. Here are muscles that you've been seeing on the lab side. The right side of our model, which is his right, not yours, it has the superficial one. So we see the outermost muscles. His left side is the deep one. So this is after removing the superficial muscles, we're able to see those underneath. There are a lot of muscles, and these just basically scratch the surface. There's many more underneath these muscles. These slides are here to give you really good views of all of these different muscles that we're talking about in the coming slides. Not all of these are going to be on the lecture exam. The ones that we go over specifically in the future slides will. Let's play a little guessing game. What muscles are they using to do this? The first one, the raising of the eyebrows, that was the frontalis muscle. That is right over the frontal bone on your forehead. To purse your lips or pucker them, you use the orbicularis oris. That's that round circular muscle that surrounds your lips. What about this muscle in her neck? It comes from the area of the sternum and goes up towards her ear, if you can make it out. This is that weird one I mentioned before, the sternocleidomastoid. It pulls the head to one side or to the chest. If you imagine just contracting only this one muscle, it's going to pull the head in one direction. If you were to contract both of your sternocleidomastoids, it pulls the head downward towards your chest. We are currently being winked at by a cat. What muscle is that cat using? He's winking at you using his orbicularis oculi. This is a round circular muscle that surrounds the eye and allows you to contract the eye. Now, this guy, his blank is broken, so they're having to hold it up with clothespins to keep him smiling real big. What muscle is it that helps you to smile? It's called the zygomaticus. The zygomaticus pulls up the corners of your mouth. On this model, you're able to see it crossing the cheek. When that is contracted, it just pulls up the corners of your mouth in a big smile. Genie, his jaw dropped in this picture. I don't think he even has a masseter and a temporalis muscle. The masseter muscle is the largest muscle in your cheek that closes the jaw. It allows you to chew. It's a very powerful, very large muscle. And in animal species that have even larger ones, it is what gives them that bite strength. For our lecture exam, those are all of the muscles of the head that we're going to talk about. Let's move on to the arms. For your arms, the first muscle that we talk about is the pectoralis major. This large muscle pulls the arm across the chest and can also rotate and adduct the arm. One side of the pectoralis major attaches to your sternum, the other one to your humerus. Which one would be the insertion and which would be the origin? The origin is the less movable bone. That would be the sternum. So it has a sternum origin and a humerus insertion. When it contracts, it's able to move the humerus. This picture of Bruce Lee from The Way of the Dragon shows a large muscle visible. We can see it behind his arms. What muscle is that? If you guessed latissimus dorsi, you were correct. This picture is of someone's back, and this large muscle will cross your entire back, originating down at your pelvis and along your spine and inserting on your humerus. This helps with moving your arms. Headed down the arm, we have the deltoid, the subscapularis, and the infraspinatus, the biceps brachii, brachialis, and the brachioradialis. Now those guys, you don't have to, for lecture, memorize the individual actions. Just know that those are in the arm. For your wrist and hand, we have a list of flexors that pull it inward like you curl it into a fist. All of those muscles are on the inside, and when they contract, it pulls the fingers in. Your extensors are located on the back of your hand and the back of your fingers, and when they contract, they open the hand up. That's it for the arms, and we can head on to our abdomen. This is our overview of the entire abdomen. Once again, on the right side, we are superficial. On the left side, we are deep. Here's the back, with the left side being superficial and the right side being deep. It's the same person, but the deep side just has all those superficial muscles removed. The big ones that we have to know are the respiratory muscles. The first one is the diaphragm. It separates the thoracic cavity from the abdominal cavity. The contraction of the diaphragm causes inspiration or breathing in. Then we have the external and internal intercostals are around the ribs and they assist us with breathing. We have external and internal obliques that compress the abdominal wall, a transverse abdominis that also compresses it, and the rectus abdominis flexes the vertebral column when it contracts, allowing you to bend over forward. And if you contract it nicely and you don't have a layer of fat over it, contracting the rectus abdominis is going to show us your six-pack. Does anybody know the name of this muscle shown here on a model and in person on a bodybuilder? It's called the trapezius. This muscle is trapezoid shaped, and its function is to raise your arms and pull your shoulders downward. So if you straighten your back and pull your shoulder blades in, you're using your trapezius. Here is the pectoralis minor. If you remember that pectoralis major that we saw that connects to your arm, the pectoralis minor is underneath it. The smaller muscle pulls the scapula downward and raises the ribs. Moving on to our legs. A big one is the iliopsoas major. This muscle is responsible for flexing our thigh. It originates at the spine and the top of the pelvis and inserts onto the femur. Unlike a normal individual, With bodybuilders, they work hard for you to be able to see their muscles and to have that definition. And you can really see in this picture his hamstrings. The hamstrings is a general name for muscle group called the biceps femoris, the semitendinous, and the semimembranous. All of these muscles are located on the back of the thigh. On the inside of the thigh, there's two muscles called the adductor magnus and longus. One is larger, the other is longer. They adduct the thigh or pull it back towards the body. On your back end, you have your gluteus maximus and your gluteus medius and minimus. The maximus is the biggest butt muscle. It's what you sit on. The gluteus medius and minimus are underneath the maximus. On the back of the thigh, we saw the hamstrings. On the front of the thigh, we see the quads. On this model, they are very exaggerated. The one in the very middle is called the rectus femoris. It runs right down the middle and it's straight. This one extends the leg at the knee. If it contracts, it pulls up. This one extends the leg at the knee. The quads also include the vastus lateralis, which is on the lateral side, the vastus medialis, which is on the medial side, and there's one underneath the rectus. This soccer player is using a special muscle that is kind of interesting in its location. It starts on the lateral side of your pelvis, and then it comes across the front and connects to the medial side of your knee. It's rather strange. It's the only one that does it like that. Whenever it contracts, it's going to rotate the thigh laterally, but the lower leg medially. It's interesting, but it's wonderful for playing soccer. This person is doing physical therapy, and there's a muscle that these arrows are pointing at. This muscle is called the tibialis anterior. It's a muscle that runs down the very front of your lower leg, just beside the edge of the tibia. It inverts the foot and helps point it. Another guy who did not skip leg day. He showed up for every single leg day. He has very large gastrocnemius muscles. They're in the back, but it's what we call our calves. The gastrocnemius flexes the foot and flexes the leg at the knee. Because it flexes the foot and the leg, we're going to be using the gastrocnemius whenever we're jumping, for example. This guy also has large gastrocnemius muscles, but look at how well defined his Achilles tendon is. All of this almost triangular area beneath the gastrocnemius is the Achilles tendon that comes down and attaches to the heel bone. Now, it's a tendon, not a muscle, but it's a very strong, fibrous structure. It's very hard to break, but if you do, the only way to fix it is through surgery. The soleus is a muscle that flexes the foot. It's behind the Achilles tendon. We also have a couple smaller muscles that help flex that foot. Here's another view of the anterior thigh, allowing us to see all of those muscles that we just talked about. Here we can see the gluteus maximus on the outside that's been cut, so we're able to see the area beneath where the gluteus medius has also been cut, allowing us to see the gluteus minimus. Here's the anterior view of the lower leg, showing us that tibialis anterior muscle, and the view of the lower leg on the back. This shows us the gastrocnemius muscles of the calf, the Achilles tendon connecting to the heel, and the soleus muscle behind the Achilles tendon. Have you ever heard of tetanus? You've probably already been vaccinated for it. Tetanus comes from getting an infection where a certain bacteria comes in, often from a rusty nail, and it causes your muscles to contract, specifically the muscles of your jaw. Do you know which muscle it would be? The masseter. The masseter contracting will cause you to have lockjaw and you're unable to even open your mouth to eat. The last thing we have for this PowerPoint is a hernia. A hernia is a rupture of the abdominopelvic wall. It causes parts of the organs in your abdomen to squeeze out through that opening. Your viscera protrudes through the tear at a weak point. An inguinal hernia is the most common type because there is an opening through which blood vessels and spermatic cords travel. If a hernia like this develops, then you have to surgically go in and repair it, trying to fix that weak spot. All right, that concludes the muscular system lecture.